living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
We hear about good and bad cholesterol, low and high cholesterol. But what are we really talking about when we say cholesterol, and how does it affect your heart health? Welcome to Healthy Living for Life, a show dedicated to doing just that. I'm your host, Beth Brown. Today we are going to talk all about cholesterol so we can understand it better, and we'll also dispel a few myths. Stay tuned, we'll be right back after this. Welcome back to Healthy Living for Life. This morning we'll be talking to Britt Ballinger, who is a nurse practitioner, who is going to help us with some of the cholesterol basics. Thanks for being with us this morning, Britt.
Thank you for having me.
It's our pleasure. So let's start by just defining this thing. What is cholesterol?
Cholesterol is a fatty substance that exists in the body and is made by the body. It actually is useful in all cell function. However, if you have too much of it, then it can cause problems.
So when you say cell function, what exactly does cholesterol do for us?
All the cells use it for different things, particularly the brain. So it just is, it's part of the cell wall. It's needed for normal cell function.
Okay. So let's talk about the two types of cholesterol. First, what is LDL?
LDL is the low density lipoprotein, and that's the one we call the bad cholesterol or the lousy cholesterol. And that's the one we usually target in treatment. We want that one as low as possible. So keep that in mind. The L stands for low, and it's lousy.
I like that. That's a good thing to remember. And why is it bad?
That's the one that can adhere to the cell walls in your arteries and cause problems.
Okay. And then the other one is HDL. So how is that different from LDL?
That one is, the H stands for high density lipoprotein, and I call that one the happy cholesterol, and that one is the one we want high, and it actually can bind to the LDL and remove it from your bloodstream. So it actually can reverse the negative effects of the LDL.
Can you explain what triglycerides are and how they relate to cholesterol?
Triglycerides are the fatty substances, and the total cholesterol doesn't really contribute with the triglycerides. It's kind of a separate thing. They do a calculation to using the total cholesterol and the triglycerides to figure out the profile you're working with.
And how do you measure cholesterol? It's
a blood test. They will draw your blood after you've fasted for at least 8 hours, 12 to 8 hours, 8 to 12 hours, and they'll just draw your blood.
And then what will you say to a patient? What do the numbers mean as far as their cholesterol goes?
In cardiology, we focus mostly on the low density lipoprotein. And if you have heart disease, you're already going to be treated for that, because the treatments we use can reverse some of the problems caused by having high cholesterol over time. So if your cholesterol numbers are high, we take into account your entire risk factor profile and then decide what treatment is needed.
Is cholesterol something that's usually measured or tested every time you get blood drawn, or how often does that happen?
That, again, depends on your risk factor profile, at least every couple years as an adult if you don't have any risk factors, but that is something you'll need to talk to your doctor so they can kind of help you tease out what your risk factors are. Risk factors include your family history. If you have a family history of heart disease or high cholesterol or hypertension, if you have obesity, if you have diabetes, if you have high blood pressure, those are things that you need to talk to your doctor about, and they'll decide how often you need your cholesterol tested.
Can you talk about why it's important to get your cholesterol tested?
Treatment of high cholesterol is the underlying cause for vascular disease, including strokes and heart attacks, because it causes blockages in the arteries. So if we test it and it's too high, we can treat it with lifestyle modifications and also medications to try to reverse and help avoid some of those problems.
So you mentioned family history can be a risk. What are some of the other risks that people should be aware of when it comes to cholesterol, and when should they talk to their doctor if they're concerned about it?
If they have a family history, if they're obese, if they have diabetes, if they have high blood pressure, exercise is really important. If they're not exercising, exercise can actually lower blood pressure and cholesterol.
Okay, and then we also talked about that you get a blood test for that. Is that something that you do with your doctor, or where would you get that blood test taken?
You'll need to have your doctor order it. They will need to go over the results with you to discuss the results and go over your risk factor profile so you can make decisions with them about what you want to do for treatment.
Okay. I think we should focus too on, lots of times cholesterol is something that an adult should focus on, but are children also at risk?
They are, and it's a rising epidemic with obesity. That's, again, I don't treat pediatric patients, so I'm not sure what the guidelines are. So I would defer to the pediatricians. I was reading about it, and it is on the rise, and it sounds like they're testing kids more often nowadays.
So similar risk factors there as far as family history, obesity, or those things that happen as you get older?
No, it can happen as a child, especially with certain medications and especially with childhood obesity.
Okay, perfect. All right, so it is time to take a break. So we're going to pause here for just a moment. So thanks for that information. We need to take this commercial break, and then we'll talk about some risk factors and also discuss treatment options if cholesterol is an issue for you. Don't go away. We'll be right back after this. Welcome back to Healthy Living for Life. We're still talking with Britt Ballinger this morning about cholesterol, so thanks for staying with us, Britt.
Thank you.
So can a person's cholesterol get too low, or is it only a concern if your cholesterol is high?
Low cholesterol is very rare. We hardly ever see it, and it can be a sign of other problems. So it's not something we typically treat. There's usually something underlying going on.
Okay.
And it would be hard for us to get it too low to affect your cell metabolism with treatment.
Okay. Are there symptoms related to high cholesterol, or how does somebody know if they have it?
The only way to really tell is a blood test. If you have really high cholesterol over a long time, you can develop skin deposits on your joints and below your eyes called xanthomas, but that's very late that means you're in trouble. You have risk for heart attack and stroke.
Okay.
Really high risk.
Let's talk about heart health and how cholesterol is related. What does cholesterol do to impact your heart health?
The bad kinds of cholesterol, like LDL, they can adhere to the walls of your arteries and cause blockages, and that's what causes a heart attack. So, and a heart attack, can make your heart weak. So that's how it impacts your heart health.
And then you mentioned stroke as well. How does cholesterol impact your risk for a stroke?
It's the same idea, except the vessels in the brain are blocked, and then it reduces blood flow, and blood carries oxygen to the tissues. If we block the blood flow, your tissues aren't getting oxygen and they die.
Okay, can you talk about how cholesterol and diabetes are related?
Yes, people with abnormal blood glucose levels or diabetes tend to have higher cholesterol. So if you're diagnosed with diabetes, it's typical for you to be on treatment for high cholesterol, regardless of your numbers.
And so does cholesterol also impact your sugar levels, or is it just because of how it's blocking your arteries?
I don't think cholesterol impacts the sugar levels. It's more of a risk factor profile. If you have diabetes and high cholesterol, your risk for developing complications such as heart attack and stroke are super high. So they kind of go together in the risk. How they develop is on the lab work is sort of aside.
Okay. And we're going to focus on diet and how diet plays a role with cholesterol after the break. But what are some of the other risk factors that might contribute to that bad cholesterol?
A sedentary lifestyle, not exercising, obesity for sure. Smoking can contribute. A lot of people who smoke tend to do the other unhealthy things too. A high-fat diet, the usual healthy things.
Okay. And let's focus on smoking for just a second. So how does smoking, is it the tobacco, the smoke, how does that play a role when it comes to your cholesterol?
It really doesn't impact the numbers per se of the cholesterol. It just adds another risk factor. It definitely impacts the blood pressure, smoking and tobacco and using tobacco. But then you add a third risk factor. So smoking is a risk factor by itself. It increases the blood pressure, which is a risk factor. And then if you add cholesterol to that, then you're kind of a ticking time bomb.
Okay. So if someone is trying to lower their cholesterol, what exercises would you recommend for that person?
Again, cardiovascular exercise is the best. 30 minutes most days of the week. Just walking is fine. Just move your body. It's the best thing you can do for all of your health.
Are there medications that are an option when it comes to treatment?
There are, and we use they're a little controversial. I'm sure you've heard of statins, Lipitor. But once you've developed the consequences of high cholesterol, such as a heart attack or stroke, it's sort of, taking the lesser of evils. Definitely there are side effects, but there are side effects to having high cholesterol, like a heart attack and stroke. So that's something you need to talk to your doctor about. There are some new medications that have good data. They're injectable, and you take them once a week or once a month. So if you have a familial hypercholesterolemia or can't take the statins, that there are more options.
So before the break, we talked about triglycerides, and we talked about the relation of those to cholesterol. Do people go on medications just for high triglycerides or high fats, or is that different?
They do. If you just have high triglycerides by themselves, we can treat that with a different kind of medication. Your risk with just high triglycerides is mostly for pancreatitis, and it's very diet related or genetic.
So it's almost time for us to take another break here, Britt. We just have about a minute left. Any closing thoughts you would like to offer to our viewers when it comes to cholesterol and managing cholesterol?
Again, a healthy diet and exercise are the best things you can do for your health, as well as not using tobacco.
Perfect. All right, Britt, thanks so much. We appreciate your time.
All right, thank you.
And we'll pause here for a break, but coming up next, what we eat can often play a big role when it comes to managing our cholesterol. We'll talk to someone who can give us some tips on how to eat right. We'll be back after these messages. Stay with us. Welcome back. We're going to continue talking about cholesterol this morning, but now Tolly Patton has joined us, and she is a registered dietitian to talk to us about how our cholesterol can be impacted by our diet. And thanks so much for being here this morning, Tolly.
Thank you.
So let's start out. We talked earlier with Britt Ballinger, who's a nurse practitioner, and we learned from her that not all cholesterol is bad. So do certain foods have different types of cholesterol in it as well, as far as you have to be careful about good and bad cholesterol when you eat, or does that not apply when it comes to your diet?
Cholesterol found in food is all the same. Cholesterol in food doesn't really affect your blood cholesterol level as much as the type of fat that you eat. You have your saturated fat, and then you have your unsaturated fat.
Okay, so healthy foods can have cholesterol in it. It's just not necessarily as bad as unhealthy foods? Or what type of healthy foods could have cholesterol in them? Or no healthy foods have cholesterol in them?
Well, cholesterol, as you learned from Britt, comes only from animal products.
Okay.
So, but your cholesterol found in food is all the same. and it doesn't affect your blood cholesterol level as much as the type of fat that you're eating. So you have your saturated fat and you have your unsaturated fat.
Okay.
Your saturated fat are the ones that are found, and your unhealthy saturated fat are the ones that are found in your processed meats, such as your hot dogs, your sausages, your bacon, your pastries, your ice creams.
Okay. And we want saturated or we want unsaturated? Just
unsaturated.
Okay, cool.
Yep.
And so what foods have those the unsaturated fats in them that would potentially be healthy for us?
Your unsaturated foods or fat is found in your, well, unsaturated fat means that it is mostly liquid at room temperature.
Oh, okay.
So your oils, and you're also going to find your unsaturated foods, your fats found in foods in your flax, your walnuts, your nuts, those types of foods.
Okay, great. So if someone were to come to you who has high cholesterol, what kind of foods or what kind of diet would you recommend for that person?
They would go on a lower fat diet.
Okay, and so you've already talked about some of the unhealthy foods. Should they be careful about the healthy foods they eat, or there's no real concern when it comes to healthy foods as it relates to your cholesterol?
Well, dietitians like to say, and I agree with that, is that all foods in moderation. So even if a food is unhealthy, as long as you're eating in moderation, we never tell somebody to completely take out any food out of their diet.
That's nice,
I
because
know.
that's hard for folks to do too.
It is. Moderation is key for everything.
Awesome. And so let's talk about soluble fiber. What is that? What foods have soluble fiber, and how does that relate to cholesterol?
Well, soluble fibers are fibers that dissolve in water, and then it helps slow down your digestive system. So there is no set recommendation through the RDAs of how much fiber that you should have, but the experts agree that you should eat between 25 and 30 grams of soluble and insoluble fiber together. They want about a fourth of those from soluble fiber, and your soluble fibers are found in your fruits and vegetables, your whole grains, your legumes like your black beans. But with that, we also want to make sure that you're drinking enough water because it forms a gel, it aids in the digestion, and then it also will help prevent constipation. Most Americans currently only get 12 to 15 grams of fiber a day, so increasing fiber overall is just such an important part of everybody's diet.
Okay. And you already talked about unhealthy and healthy fats. Can you talk about label reading a little bit and what people should be looking for if they're trying to determine the fat levels that are in foods?
When you're looking at a food label, first of all, it's going to tell you your cholesterol, it's going to tell you your total calories, and then underneath that, it's going to tell you the fat, and then the fat is going to be broken down to, is it saturated fat, is it unsaturated fat, or is it trans fat? And that's the part that you need to look at. No more than 30% of your diet should actually come from fat in a typical day.
Okay, and what is trans fat? That's different from unsaturated and saturated?
Correct. Trans fat, it happens when you're making margarine, and you will have heard a lot about that. Trans fat happens through the hydrogenation process, and that's when it's making the unsaturated oil into a solid, so margarine can be solid at room temperature.
Okay, and let's talk about margarine, because a lot of people think butter is unhealthy for you, margarine is healthy for you. Can you speak to that a little bit?
Yeah, that's kind of always a question that's being asked. Butter is 50% saturated fat. The rest of it is water and unsaturated fat. It is an animal product, so it's going to contain cholesterol. Margarine is usually made from vegetable oil, so it's not going to contain any cholesterol because obviously it has no animal product in it. Is it healthier for you? It depends on the process they use. If they're using the hydrogenation process and it contains trans fat, we know that trans fat is a risk factor for cardiovascular disease. So legislation has been happening in these last few years trying to get trans fat out of every food that there is. And in the labeling laws, you will see that it has to be labeled if it has trans fat. The only problem with that is that if it contains less than 1/2 gram of trans fat, then it does not have to be on the label. It can be labeled as 0. So when you're looking at your margarines, you want to look for the margarines that don't contain any trans fat, that they've changed that process. And really, when you're looking also for why you're using margarine or butter, like if you're frying in it, your best choices would be to use olive oil or to be using a cooking spray. So when it really comes down to margarine and butter, it has to be a personal choice. Do you want do you want the flavor that butter gives you? Do you want margarine? And if you're choosing margarine, choose a margarine that doesn't contain any trans fat, but it comes down to what's your personal preference.
Okay, awesome. Let's switch from fats and talk a little bit about salt and sodium. So a lot of times when people have high cholesterol, they're put on a low sodium diet. How are cholesterol and salt related?
Well, usually when you have cardiovascular disease, that's when you're on a low sodium, low fat, low cholesterol diet. And most of those diets for low sodium include, the recommendation is to eat less than 2,000 milligrams a day, or a 2-gram diet. And really the easiest way to reduce salt out of your diet is not to eat any processed foods. So anything that comes in boxes, anything that comes in cans, and then also to quit using the salt shaker at your table.
Okay, great. And we're almost out of time, but really quick, snacks can be a pitfall. What are some healthy snacks people can turn to?
Fruits and vegetables.
Okay.
The go-to for everything.
Okay, perfect. That's great. Thank you so much, Tali. Good information. We appreciate your time.
You're welcome.
And thank you so much for joining us this morning. Be sure to come back again next week, and we'll see you then. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.